Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Good morning and welcome to Cardinal Minute. And here this morning, very pleased to have Dr. Daniel Kelmenson, who is the Assistant Professor of Medicine and Associate Director of the Medical Intensive Care Unit at University of Alabama, Birmingham. And he did a spectacular presentation this morning for the University of Louisville Grand Rounds entitled ARDS, Diagnosis, Treatment, and Mimickers. Dr. Kelmenson, please summarize your talk for us in the Cardinal Minute.
Thank you, Dr. Williams. Acute respiratory distress syndrome, or ARDS, is a umbrella diagnosis that can be caused by a number of specific diseases like sepsis, aspiration, pancreatitis, trauma. When you're thinking about diagnosing ARDS, you really need to think, have you figured out what is causing it? And if you have not found a cause, you need to think, is this actually a mimicking condition of ARDS? Something that looks like ARDS based on history or imaging, but is actually a different disease. Those include heart failure, diffuse alveolar hemorrhage, eosinophilic pneumonia, hypersensitivity pneumonitis, and organizing pneumonia. And sometimes you'll need to do more invasive diagnostic tests to identify the condition that looks like ARDS, such as bronchoscopy with bronchoalveolar lavage, or in special situations, VATS biopsy to diagnose something like organizing pneumonia. Once you've diagnosed your disease, if your patient is intubated, there's strong evidence for low tidal volumes on the ventilator to help lower the patient's mortality. And there's strong evidence for proning as well as a mortality beneficial intervention on the ventilator. But proning can also be done for patients on the wards who are not intubated and may decrease their risk of becoming intubated. The other therapies we do have evidence that is not as strong, but we often diurese patients to sort of dry out their lungs and remove any cardiogenic pulmonary edema. We give steroids, especially for COVID ARDS. And as a rescue strategy, we often apply ECMO when a patient has hypoxemia.
Really fantastic. Thank you so much for that really comprehensive Grand Rounds and very informative Cardinal Minute. I'd like to let everyone know that we'll be off for a couple of weeks for the holiday season, and we'll be back on January 5th. And thank you once again, Dr. Kelmenson.